Okay, how many weeks pregnant are you? Because I'm willing to bet if you're watching this video, you're like 39, 40, 41. Let's go over some ways that you might be able to induce your labor naturally. I'm Tina B, and by the end of this video, you are going to have 6 new things you can try if you're hoping to meet your baby sooner rather than later. But before I get started, I want to mention something. 37 weeks, that used to be considered term when baby was all done developing, but now 37 weeks is considered something called early term, or baby still has some cooking to do. 39 weeks is now term. If you are hoping to try to induce your labor naturally, it's best to talk to your provider always and to wait till 39 weeks. But with that said, let's get into it. Tip number 1, try walking. Walking is a great way to try to induce your labor naturally and to progress your labor from early labor into active labor. And that's because as you're walking, you are shifting your hips, which is going to change the angles of your pelvis. And when we do that, we allow baby to better engage into your pelvis or to drop down into your pelvis. And what we're hoping to do when we engage a baby is put pressure onto your cervix, because when your baby puts pressure onto your cervix, it's going to send signals to your brain to release oxytocin into your bloodstream. And oxytocin is that wonderful hormone, the love hormone. It's responsible for uterine contractions that are going to change your cervix. So walking is always a great place to start. You can also do something called curb walking. This is great because it opens up your pelvis in more of a diagonal and uneven motion, which is awesome for rocking open that mid-pelvis. And the middle of your pelvis is the narrowest and the tightest area to open up. But if we can get it open, that's going to further help baby to descend onto your cervix. So it's great for labor induction. If you don't have a curb nearby, you can also do this on your staircase inside. Just make sure that you are holding onto the railing for support. Method number 2 is a membrane sweep. This is going to be done by your provider, usually in their office at one of your prenatal appointments. Now, the purpose of a membrane sweep is to actually separate the amniotic sac from the uterine wall all the way around the cervix, because when we do that, it releases something called prostaglandins. And prostaglandins, they work on the cervix to get it ready for labor. They're going to soften it a little, they're going to efface it a little, and they might even dilate it a little bit. Now, this is going to work, if it does, within 24 to 48 hours, and it's usually the most effective on people who are more than 40 weeks pregnant or who have had babies before and are ready to kick into active labor. To do a membrane sweep, you do have to be a little dilated though, because your provider has to be able to get their finger through your cervix to perform a membrane sweep. And there are some risks. It might be mildly uncomfortable. Some people actually say it's more than mildly uncomfortable. You might have some spotting and some cramping. And the biggest risk is that it could actually cause an accidental rupture of your membranes. And then you would be committed to having your baby, which if you're hoping to have your baby, probably wouldn't be the worst thing for you. Method number 3, you knew it was going to be on the list, is sex. Sex is said to induce labor for a couple of reasons. One is that men's semen actually does contain some of that prostaglandin, which of course works on the cervix to thin it, dilate it, and soften it to get it ready for labor. The other reason sex could induce labor is if you climax, you're actually causing a small uterine contraction, a big uterine contraction if you're really lucky. But that uterine contraction could bring that baby down slightly onto the cervix, which might just be the little push you need to get labor started. Method number 4 you may want to try is nipple stimulation. Now, why might playing with your nipples start your labor? It's because nipple stimulation actually simulates breastfeeding. And when a baby is breastfeeding, it causes our body to release oxytocin. And as we know, that oxytocin is responsible for those big, beautiful labor contractions that change your cervix. So if you stimulate your nipples, it could cause an oxytocin release, which could cause the onset of labor contractions. Now, you can stimulate your nipples, or your partner can stimulate your nipples, or you can use a breast pump to stimulate your nipples. Method number 5 is eating dates. Now, it seems odd that a teeny tiny food could actually bring on labor, but dates contain necessary and unnecessary fatty acids that go on to produce prostaglandins. And if you're seeing a theme with the prostaglandin train, you would be right. Those prostaglandins produced by the dates hopefully are going to ripen or ready your cervix for labor. And there's actually been studies shown that eating 6 dates a day can shorten your active phase of labor and get that cervix ready for labor, which would make inductions less necessary. Fingers crossed. But failing all of that, dates are actually also really dense in calories. So they make them a really, really good food to eat in pregnancy if you don't have much of an appetite, because it's a small amount of surface area for a big pack of nutrients. And they're great to pack in your hospital bag as a snack because, again, lots of calories for the marathon that you're about to run. And the last method on the induction list, oh, I would never recommend this to anybody, but so mmany people are doing it and so many people stand behind it that I thought it was important to put on the list so you'd have information on it. It's castor oil. Okay, yes, there are studies out there that say that castor oil could ripen your cervix and bring on uterine contractions, but there are just as many studies out there that say that castor oil really has no bearing on when you're going to go into labor, nor is it a good method of induction because it actually might cause more harm than good. So castor oil is a derivative of a plant from Southern Asia, and its original intended use is actually as a laxative. So if you're considering taking castor oil as an induction method, you might expect some of those laxative side effects: abdominal cramping, nausea, vomiting, diarrhea, and if the diarrhea is bad enough, you could actually cause dehydration, which we know in pregnancy can be very, very dangerous. And the castor oil can actually bring on abdominal cramping that's so intense, it could be mistaken for labor contractions, which could cause you to go to the hospital prematurely. There's also anecdotal evidence out there that says that castor oil could actually cross the placenta, which would mean that baby would see some of those laxative effects, which could cause them to pass stool in the amniotic fluid, and this in itself is going to have some health risks for baby. With all that said, castor oil still is a really popular method of labor induction that people choose. So if you're going to do it, usually people do 4 tablespoons in a glass of juice, usually orange juice, to mask the taste. You would be wise, though, knowing that it causes laxative effects, to take this concoction in the morning so that you can monitor how you're feeling, and especially so you can monitor baby's movements throughout the day. So there you go, 6 new things you can put on your roster if you are trying to induce your labor naturally. But please do remember, the more time baby has inside, the more growth and development that they can do before they come and meet you outside. I know you're tired, I know you're done being pregnant, but I promise you, your baby is coming to meet you very, very soon. If you like this video, go ahead, give it that thumbs up, check out this other video, and consider subscribing to learn more.